I'm Susan Fangman. I work for K-State Research and Extension here in Shawnee County, Kansas, as a family consumer sciences agent. As part of my job, I'm also a senior health insurance counselor of Kansas. Right now is Medicare Part D open enrollment. My appointment book is full, as well as most senior health insurance counselors that I know. Because of that, I am here to show you how to navigate the Medicare Part or the Medicare.gov website so you can shop your own drug plan and get yourself enrolled if you need to. I'm going to share my screen. And we'll go to Medicare.gov. And then here it will remind you that open enrollment ends December 7th. So we are almost there. We are going to look at find health and drug plans. You can log in if you want, but I'm not going to. So continue without logging in. For today's example, we're going to look at prescription drug plans only. We will want to enter our zip code. And then if you get help from one of these programs to help pay for premiums or prescriptions, you'll want to click on that. But for today's example, I'm going to show that I don't get help from these programs. And we want to shop the cost of plans with our prescriptions entered in. So I'm going to click yes. And then I'm going to enter just a few common prescriptions. We'll put in Synthroid. And this tells us there's a generic available, but we're going to assume we're on the name brand. So we're going to add brand instead. Make sure you enter the correct dosage. And then I like to enter these as a monthly cost if it's something you take every day. So $30 a month. Then let's add in a atorvastatin. Get our dosage in. Then we'll add one last one. And that dosage in. Now, if you were to, like if you're on a rescue inhaler and you only fill that once a year, there is an option here where you can click every 12 months. So know that is there. All right, we are finished entering prescriptions. And then the next part we want to add is our pharmacies. Now, if there's only one pharmacy you want to go to, then just enter that one pharmacy. But to get the best idea of where you're going to get the best cost, save the most money, enter several pharmacies if you've got them available to you. So I'm going to enter those three. You can add up to 5. And the Plan Finder ranks plans in order of least expensive to most expensive. It uses this number right here, which is the yearly cost for your prescriptions if you entered them or if you filled them as we have them entered, as well as your premium cost for the whole year. So this is the number the Plan Finder is using as it compares things. It also has the deductible figured in to this final number. This particular plan has a $6.60 a month premium, which is the cost to have the plan each month. We can look at more details here in a minute, but I like to look at the first couple plans this way. The next plan is a WellCare Value Plan. Know that several of these plans, there are several WellCare plans to choose from. So pay attention to the entire name of the plan. This premium's $12.60, and here's its total cost. It has a $480 deductible like the first one. And then here's the third plan. So you can click in here under plan details and learn more about the plan. This shows us which pharmacies work with what plan. So Dillon's and Walmart are preferred in-network pharmacies. That means you'll get the best pricing at those pharmacies. This particular pharmacy is out of network with that particular plan. Right here, we find a yearly drug cost by pharmacy. So each prescription has a yearly cost for it by pharmacy. Notice the big difference between out of network and preferred in-network pharmacy pricing. I like this little box. It tells you when you're going to meet your deductible. You go to preferred pharmacy, it's going to be in November, and you won't enter the coverage gap on those particular prescriptions. I don't see a lot of people who do, but there are some who do. Get into the coverage gap. You might know it as the donut hole. This is an estimated total monthly prescription cost. This is what you'd spend if you filled all of your prescriptions at one time in January. Notice the price changes down here is because we've met the deductible. Then you can click on a pharmacy and it shows you what each prescription costs per month. This is before deductible costs and then after deductible costs. So the Synthroid changes price after you've met the deductible. You can view a few other things under here. Shows you what tiers your prescription's in, if you need prior authorization, quantity limits, or step therapy. One other feature of this program is you can put several plans side by side by clicking the Add to Compare button. So this shows us the star ratings for each of these plans, premiums, deductible. And then this gives us an idea of what prescriptions and premiums would cost going to the different pharmacies on each plan. Once you decide what plan you'd like to enroll in, you just hit the enroll button for that plan. Join plan. It's going to ask you your Medicare card number, some basic contact information. There's several optional questions that you don't have to answer if you don't want to. But the biggest part I would say is saving that confirmation number that you get at the end. You should get some info from your new plan in about 2 weeks. Know that if you enroll yourself in a plan here, it will automatically unenroll you in your current plan starting January 1st. So you don't need to make any contact with your current plan to unenroll. The other thing that I would mention here is, like I said, make sure you say that confirmation number. But also, if you decide you don't need to change plans, then no action's taken. If you want to keep staying in your current plan, they're just going to keep you in it. It does not require you to do anything online or to contact anybody. So I hope you found this video helpful. I'd love to hear about it. If you did, good luck. Make sure you get this done by December 7th. And it's important to shop plans every single year. So next year, take a look at your prescription drug plan or give your local senior health insurance counselor a call before Medicare open enrollment starts so you can meet with them. Thank you.